Welcome to Open EMR. We're going to do three things today. First, I'm going to show you how to do a patient encounter. Then I'm going to show you how a physician can create his own customizable forms for assessments. And then I'm going to show you how that same doctor can send meds to the pharmacy so a patient can pick up their scripts. So let's begin. If we look to the left, just below the navigation pane, we can do searches by date of birth, by social security number, by name. If you were to click any, all the patients would come up. Let's see. But since we've already got something in Dale, they're not going to. So if we click any, all the patients would come up. We only have one patient presently in the database. So I would click on that patient. Patient's information would come up, and then we would come over here to encounter history. We would say that this is a new encounter. And on this form, we would write in the chief complaint. So the chief complaint at this time is stage 3 critical hypertension. HTN is the medical abbreviation for hypertension. He is an established patient. Here, if we had more than one facility, we would select the service facility. That is the facility where the patient would be receiving service. We would then select the billing facility. In this case, they're one and the same. And of course, the date defaults to today. Over here to the right, we see the patient has a self-allergy, an allergy to codeine. Past medical history significant for hypertension. The patient is on atenolol and has had an appendectomy back in November of 13. So let's save this encounter, and then it saves the OpenEMR database saves this as an encounter. Another way to do this would be to come over here to calendar. And then, of course, the default is today. If it's 8 o'clock and I get a phone call and we have a patient trying to make an appointment for 11 o'clock, I would come over here and click 11 o'clock. This screen comes up. Now, we want to stay in the patient screen because we're not the doctor. We want to input information about the patient. So you want to click on office visit. We want to say this is an established patient. The default is to today. The clinic, we would select the drop-down and choose the clinic where the service would be provided. And we would do the same for the billing facility if it was different from the service providing facility. The patient's name is John Smith. Now we have to select the doctor that the patient is going to see. So we go to the drop-down, we select John Doctor. We don't do anything with status yet, but we will when the patient arrives. So the time is 11 o'clock. It automatically defaults to that, and it's in the AM. And let's say we're only going to need to see the patient for 15 minutes to do some prescribing. So we are going to save this. Yes, we want to use that. And it will come up. Now, when John Smith comes in, we want to click on that. And then we come back to status. And then we say that the patient has arrived. And then we'll save that, and it will generate our encounter for us. Or it will try to generate our encounter for us. It should come up with an encounter number in the screen. So I've just shown you two ways to schedule a patient for an office visit. Now, what doctors need to do is to create forms to do their physical assessments. And one of the ways to do that in the OpenEMR database is to come over here to Administration, come down here to Other, select Forms, and what we have here, these forms above have already been preloaded and they are enabled in the database. So some are administrative, some are clinical, and I'll show you when we look at the patient encounter how we can access these. But here is where the physician at the bottom of the screen can select things. So for instance, if he wants to do a physical exam on this patient, let's register this. And we need to look up here and see where physical exam, here it is, has come across. Now, what we want to do is install physical exam into the database to make it available so the doctor can use it. Once it's installed, we want to enable it so it can be used. Now, if we leave it this way, when we go to the patient encounter and we select clinical, it won't be there. It'll be under miscellaneous. Now, the way we get rid of that is we can copy clinical, and then we can paste clinical here. And now we've told the database that this should go under the category clinical. So I'm going to update the database. And then I'm going to go, so before we do that, a doctor can choose anything, any category out of the database to make a determination as to what they need to do a physical exam. Do they need clinical instructions? Do they need an encounter form? Certainly they're going to want to do a physical exam and create some kind of a treatment plan after taking vitals. So let's go to the patient encounter. Let's look under clinical, and you can see physical exam appears right here. But let's say the doctor wants to do some vitals. And this was these are the vitals as they come in. But you could get those values by coming over here and by inputting the information on this side, hitting Save Form, and then the information would be recorded in the database. So since that's already done, let's come back to clinical. So we'll hit Don't Save. Let's come back to clinical, and we'll look at physical exam. And on physical exam, we'll do general appearance, and we'll say patient is neat and well dressed, appears in moderate distress. And we can run down the entire list. Let's see, CV, no peripheral edema, pulses are palpable ×4, and so forth and so on. So the doctor will complete this. We'll come down here to save. And then that information gets registered back here when we do the patient encounter. So the doctor can customize their form and then proceed to do their physical exam and whatever other assessment they need to do, and then have that categorized succinctly in a manner that makes sense to them, so that they can just run down the numbers, come down here, come to clinical, decide what they need to do next, click on that, get the screen, input the information, and then hit save. Now, if we come back to the patient and we come over here to prescriptions and we hit edit, if there were no medications here, now I said that the patient had stage 3 critical hypertension, the blood pressure was something like 217/198. And the patient could possibly stroke. So what we're going to do is, if atenolol wasn't here, we'd click Add. But in this case, we're going to click Edit. When you click Add, this screen would come up. It would default to this state. We'd select the provider, which would be John Doctor. The drug would be atenolol, and if you needed to search, you could type the name of the drug in here and hit search. We're going to give him 90 tablets. We want each tablet to be 50 milligrams. They are scored, so if he suffers any side effects, and we can write this in here, if the patient suffers any side effects i.e. dizziness. He can break the pill. And take BID, or 2 times a day. So half in the morning and half at the hour of sleep. So as that hasn't happened yet, we want to add this to the patient's medication list, so we'll tell it yes. And we don't want the guy to get to pay any unnecessary medication fees. So let's tell him that substitutions are allowed. We'll come up here and we'll click Save. When you click Save, this screen comes up. If this were set up to our fax, you can click Download to the fax, and then we could fax it to the pharmacy. We could download a PDF to give to the patient. We could view a printable version of that, and since we don't want to print it, this is what it would look like. The patient could then bring the script to a pharmacy of their choosing if they didn't want us to call it in for them. So we've talked about 3 things today. How we can do a new patient encounter. We've talked about how doctors can add forms to create their own little database in a logical sequence for their physical assessments and the input of clinical data into the Open EMR database. And then should they have a need to write prescriptions and then send those scripts to the pharmacy, we've shown you that process as well. So thank you for taking the time to listen. We hope you've enjoyed the video, and we look forward to seeing you at our next video. Thank you.